This is Stronger Bones Lifestyle Podcast, and today I am going to be speaking with Dr. Angie Martinez, who is a functional medicine doctor, and we are going to be discussing the importance of internal biochemical and metabolic balance to support your bones and so many other aspects of health. Welcome, Angie.
Thank you, Debbie. Thank you for having me. Good to see you, friend.
Yeah.
Happy to be here to help you out.
Oh, happy to help me out and honestly to help all the women out, because that's the goal. The goal is to have the message out there, and really for me, for women to understand what role can they take in their own bone health, because our traditional approach right now doesn't give women any control. And that's what we need.
Absolutely. I think the knowledge is the empowering piece, and we're just growing with that knowledge, at least in the functional medicine role. We're sort of stepping out of that box and thinking more systems based, because the answer to complex problems like osteoporosis is not a simple answer like a prescription. It actually is so profoundly complex, because that's the beauty of our body. But we're growing in that knowledge and at least learning more about that so that we can actually get to the root cause and help people be proactive and address the main problems that need to help curtail this pretty significant issue. This bone health really has some big life longevity kind of risks if we don't take it seriously, or at least those of us who are interested in a proactive role. We can do something ahead of a fracture or ahead of a diagnosis of osteoporosis.
Yeah, and that's why I do what I do, Angie, because when I was 50, my hip joint collapsed.
Right.
My life became super small. I mean, I was so active and I had to not be active anymore. And coincidentally, I was a yoga therapist teaching to the aging population. So not only did I at 50 with this collapsed hip joint understand how important bones, muscles in your body is, I also observed thousands of people, the 60 plus crowd. I saw those that hadn't taken care of themselves, those that were actively taking care of themselves, and I was able to observe the breakdown in our body. So it comes, and we need to be proactive. And really, the quality of life and the what really, if you have a weight bearing injury, and people don't understand this unless you've had it, it is devastating, and you can lose almost all of your living life.
Yeah.
Yeah.
Actually, one of the newest longevity markers is mobility. Your ability to stay mobile is very important, and that rides on your strength, but then your flexibility around your hip. And so that's a very important factor. And I think we're starting to realize that just long-term health and longevity, but also independent health is becoming a forefront interest in a lot of folks who are thinking about, if we invest in our health, what would that look like? And that mobility and hip health is actually very important.
Yeah, and you have independence, and I think that that's what is a big, with all the cognitive decline that's happening for those of us that are in the sandwich generation, just maybe finish raising kids, now taking care of parents. So we're actually seeing that, and that's even more impetus for us to say, wait a minute, what can we do? So that's really, really important, that whole flexibility. And for me, this is why yoga is the superior practice for our mind, our body, and our soul, but for our bones, because it really is about that flexibility in the body. It's great. Okay, so you and I had some deep discussions recently that I want to go into. I want to understand, you're a functional medicine physician, and you and I were discussing, there's the traditional approach, there's the let's run your blood, let's find the markers, there's a disease range, and there's a pill for that. Like that's the way we've been doing medicine, right? And it's really mostly controlled by insurance, big pharma. And so here's the pill for that disease. And then you and I were discussing, well, people are sicker than ever or have more imbalance, more systems, as you said at the beginning of this discussion. They have more system breakdown in more areas, which is leading to more. And so I want to know your approach, because you said something really amazing there about the way you look at bones and this approach.
Yeah. So I've been practicing medicine for 25 years, really. It's really honing in on this way of thinking for the last 10 years. And I think it's just amazing the knowledge that we're gaining. And as it relates to the systems, I was a conventional doc doing the thing. You open up your computer, you have 15 minutes with a client and a patient, and it reminds you that they haven't had a DEXA screen, and get your DEXA screen, or it reminds you that they're osteoporotic, get them on a bisphosphonate of some sort. And never, to tell a patient or guide a patient into weight training or even looking at a vitamin D level for that matter. It was just, do you have them on a bisphosphonate? That was the reminder. So we're fed that, to make our day, overwhelming day easier. And so my colleagues sort of get caught up in that rut. It's hard to have the space to think beyond that. And so it just continues to perpetuate this, simple answer to a heck of a lot more complex problems. And as I left conventional medicine, I left because those aren't the answers to the complex problems, because I gave people bisphosphonates. They still got a fracture. And I would tell them the bisphosphonate will keep the fracture simple so you can have a surgery and it wouldn't bust your whole joints up. I mean, we just sort of were taught to talk about these bisphosphonates differently, but I realized this with all the other treatments we do in the conventional world, it was not ever getting anybody back to health. And that became an important strategy. I could not do that kind of medicine because I couldn't do anything in 15 minutes. And then I was opening and becoming more aware of like the things that I was doing wasn't actually changing the problem. And when you look at bisphosphonates, the reality is when you look at a numbers needed to treat, you have to treat 20 women to get one fracture prevention. So when we look at these medications, you have to look at that kind of data. It's not straightforward. And so some of the women were still getting fractures, even if I gave them bisphosphonates or having risk factors from bisphosphonates. And, their jaws were a challenge when they're trying to get their dental work. All of those were happening more and more. And along with other inefficiencies of complex conventional medicine, I just left because it just was no longer my calling. Had too many questions and too curious to ask the why. And so then in asking the why, I figured out there's so much within us as a system that has to work. So the answers to diabetes isn't insulin and metformin. The answers to cholesterol isn't a statin. The answers to osteoporosis isn't just bisphosphonates. When you look at that root cause and you're starting to look at systems, our bodies, the way I describe it with my patients is I tell our bodies has to have this complex network of communication. And so it's either communicating one of two base communications. It's either a communication of defend and protect or a communication of let's repair, we're at peace. And that's the perfect example of what's happening in the bones all the time. It's building up, breaking down, building up, breaking down. That's the balance and the homeostasis. Same with our body. We're always defending, we're repairing, we're defending, we're repairing. And the goal is that it's mostly in total a balance, and that keeps us healthy. But whenever we get caught up in health problems, we start tweaking that and we have less repair. We can't go back and clean up inflammation. We can't go back and repair a bone. So we continue to break down, and then you're osteopenic. And then give that more time, and then you're osteoporotic because you just tweaked that communication in our body through decades of life where you just mostly were in a defensive state. And as I work with patients, those two main communication patterns is your immune system and your metabolism. And so those are, to simplify a very complex system, if I can balance those two things, it will reflect an internal balance of a complex system. And if we can get you further into a repair situation, your immune system's at peace, then your body will do what it wants, what it needs to do, and it'll start repairing, assuming you have building blocks, of course. You need those minerals, you need some other aspects of that. But the biggest communication aspect of that, the guiding words of wisdom within our body is either defend or repair. And I look at it as the immune system and the metabolism telling our body, you're either in a defensive state or you're either in a repair state. And then we look at all those data points and see where people fall on a spectrum. And so, like yourself, Debbie, if you come to me and you said, wow, I had a fracture at age 50 some, I would be looking at a broad data points of blood work, and I would look at your immune system and say, is it trying to say defend? Or I would look at your metabolism and I'd say, man, could we find some markers that say you're actually repairing? And then if you're not in balance, then we start working at that level. And what you do, the base of getting to immune system and metabolism is gut. That's where we get the biggest leverage with those. So that's now how I practice very complex medicine in a very simplified way is how the heck can I balance out the immune system and the metabolism so people can turn around this imbalance that's been going on? Because it goes on for decades before you get a diagnosis. And our goals is, can we catch it that far ahead by looking at data?
Wow. I love that. And I love that approach. And so the whole aspect, I love this defend and repair. I love those two words. I use the words building and dissolving, and those are right in there. And I think you really raised my awareness to the immune component. I was very focused on the metabolic component of bone health because at its like the actual mechanisms are actually metabolic, right? It's either bone building or bone dissolving. Yet what I've learned recently is that the bones are one of the first organ systems to respond to stress. The bones are going to dissolve and respond. And, because being alive supersedes everything, right? If you're not alive, then it doesn't matter if you have great cholesterol or if all these other things. So it really is primary. And the gut is still the outside world. The gut is still, it's a closed system. It's still outside. It's why most of the immune system is there, 80%, because it wants to see, wait a minute, what's going to come in here? And so this is why we have to pay so much attention. And you did mention that once you get in balance, do you have the things to build? And so those things to build, the protein, the amino acids, vitamins, and minerals, well, they need to be digested and absorbed in the form to be what is there. So it really does make a difference on focusing on the gut when it comes to bones. So I want to understand your approach a little bit more. Maybe some of what you look at. What do you like? The fact that you said we weren't even checking vitamin D levels. Vitamin D is critical for calcium to be absorbed. Calcium is 99% of it's in our bones. Like, why wouldn't we even check at the top of the funnel if the system is even working?
Yeah. Medicare won't cover vitamin D more than once. Like even if you diagnose vitamin D deficiency and you want to follow that up, Medicare won't cover the second vitamin D lab. It's politics and negligence really. When you can sort of look at some simplified things like vitamin D.
I'm hoping to change that. Honestly, that's my big thing. I want to get a lot of things changed, women to be more empowered to ask, and that becomes an issue too, honestly, because we don't want this combative relationship. And honestly, Angie, it is. I'm telling you, women tell me it shouldn't be like this. I feel bullied. I want to prove to my doctor that I can. Like those are some of the terms that I hear. Like women are just, it's not a really great relationship.
Yeah, I'll give you an example of like how I would walk a woman through this kind of care that we provide here at Root Cause Medicine. My brick and mortar here. I'd give an example. I have had, a young 55-year-old, for example, comes in already with osteoporosis, and she thinks this may be because she's thin, and they tell her it's because you've been thin your whole life and you didn't have enough, muscle on you to build your bones through your life. And when she comes to me, I would actually say, okay, that's too simple of an answer, quite honestly. I start looking at her data points. So I will look at a 90 plus biomarker data points, literally off Quest LabCorp kind of labs. So it's easily accessible. And so I'll start there. And I'm looking at immune the immune markers, nutrient markers, hormone markers, metabolic markers, and even toxicity markers, because all of that plays into bone health. And as I, for example, I'll give an example of just, patterns of that I see over the years with women with osteoporosis at a younger age. A lot of times it's because, they historically had autoimmune disease like celiac or Hashimoto's, and they were just in this low-grade inflammatory state. Maybe they had really, they were driven and they had really, their jobs were very demanding, so they sat in a lot of stress. And then on top of that, maybe they had IBS, and they lived with this. It was just sort of who they were, taking supporting their symptoms here and there with their lives. And then here they are at 55 with osteoporosis. And so they don't want to start a medication, although that's what's recommended. So when they come to me and I look at their data, I could see low-grade inflammation on a CBC. Maybe they've had eosinophils that are too high. Maybe I look at their chemistry profile and I see that they're metabolically acidotic, which is, you got to buffer acidity in your body. And a lot of times my patients who are chronically low-grade inflamed also are a little more acidic, because that's sort of the body's response to that low-grade inflammation. And then maybe she's pre-diabetic because she didn't even know it, and because she's thin. Like, why would she be pre-diabetic? But it's because her cortisol is so high and she's hypoglycemic, so her sugars are erratic. And so these are all these little things that I put together and piece together. I'm like, well, you have many reasons that your bones really struggled for a couple of decades in your life to set you up for osteoporosis at age 55. And is the answer a bisphosphonate? No, because all that bisphosphonates do, when you're looking at the mechanism of bone health, is they just try and decrease the amount of breakdown. It's not really building up osteoblasts. And so if you're insulin resistant, more breakdown. If you have a lot of histamine, more breakdown. If you have tons of cortisol, these are all communicating to your body, break down, you're in defense, you're under stress. And then the body's bones have a special responsibility. They're trying to buffer the body's acidity. So they're spilling out, minerals to buffer acidity. So somebody at 55 can be healthy, eating healthy, exercising, yet this internal communication slowly sort of eroded a little bit of the bone matrix unknowingly. And then we blamed it just on being thin. But really, if we want to protect her over the next 20 years of her life, with avoiding that fracture, which is pretty high risk by the time you have osteoporosis, we would have to deal with cortisol, deal with insulin resistance, deal with that low-grade inflammation. That way she can actually get the balance to build the bone up. And by the way, if you could cut that communication down, neutralize it, tell the body, we're going to start moving to a building state. And when you get that building state, you add the strength training with you and all the work that you're doing with you, you can build your muscle mass 1 to 3% in 6 months. So, yeah, that's the whole goal for me. My role is to help people stack, all the work and investments they're doing in lifestyle. I want it to stack for them by cleaning up the communication so it's going somewhere and building, because people can still do all the right things. And if they're still in the defensive mode, it's going to take a while.
Yeah, this is really important. And even those that are listening, they're going to hear, oh, she said, check my eosinophils. They're going to go look at their CBC panels and they're like, where are my eosinophils? And where, now maybe they're looking at A1C and all of that. So, I think that our approach here was so piecemeal. We looked at, and you kind of mentioned it earlier in our discussion, we in the West look at the what. What is it you have? And we look very single focused. We're not going deeper into the why to stop it. And so the women are going to be here looking at that. This is what's really amazing for me. So I study yoga therapy. I've been to India. I'm actually leaving again to go to India soon. I go to India and study yoga therapy. And the concept in yoga philosophy is that all disease begins in the mind. And in this country in the West, we've always thought everything starts in the gut. And even in the functional medicine space, and I in the background was like, the mind, the mind, the mind. Because where's the start line for everything you just said? Cortisol starts by being stimulated by the brain, stimulating the adrenals to secrete the cortisol. That's going to start that whole breakdown, increase blood sugar, insulin has to be secreted, and then inflammation's triggered. And with the gut, the enteric nervous system is interlined in the gut. So are you in the defend or repair? Are you safe or not? Even if you're eating. But if you're watching something tragic on the TV or having a horrible conversation, your body is not in the absorbing zone.
Right.
And with this person you're referring to in her 50s with, her being thin and all of that stuff, it's all of these subconscious and conscious stimulation throughout your life, whether you had a hardcore job, whether you watch too much Instagram and TikTok and you're triggered by the feeling you have to defend yourself. Wait, my eyelashes aren't long enough. My lips aren't big enough. My tushy's not big enough. Or what was your childhood like? And Angie, this year, a lot of the women I've ran functional labs on, gut labs in particular, so many women had childhood trauma.
Yeah.
Or they were shy children. So there was that nervous, that chronic cortisol, blood sugar stimulation. And as you said, it might be slower leaks, but eventually it catches up with you.
Yeah, it stacks. And, for some folks, it just depends on maybe a little genetics and this immune imbalance, metabolic imbalance. For another person, maybe, cognitive decline. It may be a heart attack. It may be even younger people with fertility issues. It's all a systems issue of balance and having the body in its most empowered state, which is I'm at peace. My immune system is communicating peace and repair. And my metabolism is let's build and provide that energy to repair and be optimal. And so, and all that complex networking and is this network of communication that gets started, it in a place of an environment exposure, a stress exposure that's triggering mostly our guts, but it could be, literally, as you mentioned, start in the brain. And my patient population, when I do my history, over 80% of them have had some traumatic experience. And my patient population oftentimes may not have that traumatic experience that we would see as being trauma, but it's just, and I give myself an example because when I think of trauma, I didn't have a typical traumatic life, but I went to medical school and I didn't sleep and I saw like crazy stuff in medicine. I've watched death. I've, been part of that, and that was traumatic enough. And so we, don't realize that our body is having to process so much information, and our immune systems are hearing that, our metabolism's hearing that, and it can trigger and stay with us. And that's, where we are now thinking about mental health is that, yeah, the body does know, and it's keeping score, and that communication's in your immune system, in your metabolism, in your microbiome, in your nervous system. And then it plays out long term, for folks. And it just becomes, an added layer to your bucket the burden that you carry or your immune system has to deal with. So if that bucket's full, then your immune system's, I'm not at peace, I got to defend. And so it keeps you revved up. And so a lot of times, people still need all that work. But I tell them sometimes you got to cool off your histamine first, get your gut right, so then you can do that kind of work, that spiritual, mental trauma kind of work, because, that histamine's still going to yell at you, and your body's still going to hear that kind of communication. So I always tell folks, my position is, can I at least set the stage? So all this other work can really get some footing, get some grounding.
Yeah, and I think that that's what's important is that it's stacking, it's habit stacking. And as you were saying that, I'm a very visual person. I try to put it in visual terminology. So I was actually looking at a row of dominoes as you were speaking.
Exactly.
And I was thinking, okay, so all throughout life, how far down the breakdown of the dominoes are you? And those were situations, those were habits. And here's the bigger issue of all, or the big concept here too. This is not just you today or in this lifetime. This is your mother, your grandmother, your great grandmothers, because whatever they did to survive, their nervous systems, like other people when they were around, didn't survive. Right.
Yeah.
We watch, especially I'm from the UK. My parents are Scottish. When I watch all of these crazy films of the UK, life in the UK, how hard it was, all the people that died, even I think it was the Black Plague that came through there, wiped out a third of the population. That means that my ancestry survived. So wherever we come from, we survived. So that nervous system that we have, the high alert that's on defend or repair, we are so intricately wired at this time of humanity for all the millions of years or however long humans have been here. We are so sensitized and we're exposed more than ever. Our nervous systems are exposed more than ever to what we see, because we eat, we consume with our senses. What we eat with our mouths, yes, we think of that. But what about what we eat with our eyes and eat with our ears? And as you said, going through medical school, so crazy. Why are we thinking that doctors should be on those night shifts and do those 24-hour rotations? What is it we're preparing you for? That's almost like a Navy SEAL training level, right? Because why can't we have physicians work shorter hours on their rotations? Why do we have to challenge their nervous? Who came up with that concept is what I want to know, because that's a whole other thing.
Yeah.
But this whole intricacy of the nervous system that's on high alert is such a thing. So here's the dominoes, and wherever you start getting your readings, you're kind of far down that level of dominoes, and each domino represents something, right? It's either past lifetimes, it's what happened when you were a kid, it's how you ate as a teenager, and in this, 50s, 60s, 70s, 80s, and even 90s, the way that the diets that women followed were really not good, right? The anti-fat, I mean, every single cell has a phospholipid layer. It's a fat layer, right? Cholesterol is necessary because it's what builds hormones which support our bones. So just all of this misinformation, misguidance. So we all did these crazy diets, calorie restriction. So if you look at the row of dominoes, that's all the breakdown. And you said you're actually going to the very end there, like and then you start to look at, well, wait, what made that domino fall? And what made that domino fall? And what made that domino fall? And you then bring in the positive habit stacking that's going to bring the dominoes back up. Because we broke down, there were bad habits that caused the breakdown. And now we need to stack it back up. And that's the term that's used, I believe. I know you've mentioned, I think you do, the functional medicine is habit stacking, right? Because it's not just one thing. It's not just a pill.
Yeah. I think what we add, at least in being the functional doctor and the provider in this space, with that more advanced training, in addition to stacking to the habits and the nutrition and all that guidance, what we do is, at least, my support, I guess, my what makes it a little bit more special in working with somebody like myself and finding somebody like myself is when we start defining who you are, define where the breakdown was, those personal little moments, and we can actually, see that in data. We can sort of define that, connect the dots, feel this story of like, okay, this is who you were and why potentially you are where you are now. Now what we do is, at the level of what our knowledge, is that we can go in and therapeutically now adjust for the immune imbalance. If it's eosinophils versus neutrophils versus, the whatever flavor of immune imbalance you have, now we can go in and therapeutically from a really high-end supplement support and very specialized supplement combination, address every little specific nuance. That's the level we're at now. So I can look at people's immune issues, and that example I'd given, maybe somebody who has histamine, now I can put together a therapeutic combination of things to cool off that histamine. And then I can go through and look at the level of metabolism and hypoglycemia that I'm seeing, and even more than just how, encouraging a better diet approach, and sugar balancing approach, I'll actually give a specialized supplement that actually does that. So we're sort of starting to bring in all these that new novel kind of supports that are really going at the immune system and the metabolism. And that's why it's so important to understand and define that, because then you can get very specialized and precise. And now that we do things like peptides and we do some other specialty supplements, now we can put people on a protocol, 3 to 6 month protocol, and start going at balancing from the inside so that, like I say, that same term, it's funny, I use the same domino explanation when I'm talking to folks, because I tell them, I'm trying to encourage people. I'm like, I know this seems like a lot, but you have to sort of start stacking if we're going to get momentum. Just like a domino row, it's got to be close enough, because if we spread it too far, we're going to do all this work and it's going to fall and go nowhere. I got to pull things close enough so that it hits the next and it hits the next. So this work builds on the next, and not let too much time go in between, because then you sort of lose that momentum, and I want to maintain that momentum. So that's sort of how I define sort of the work with us, is that we sort of keep a little short leash, or we sort of keep a short check-in, because I want to build. I want to make sure that we're building. But those are the other little additive things. When you find a great team, you have some advanced therapeutic adjustments, then you have a team that's really working on some of that lifestyle support, and then even precision lifestyle support, because working with somebody like you, Debbie, you can start focusing in on what does that mean to get resistance training? How do you build that bone mass from resistance types of training for the type of patient, for the things that they can and can't do? And so that's actually the ultimate team. But just wanted to bring in the sophistication where we're at with functional medicine and how we're using therapeutic ways of manipulating the immune system and the metabolism. And then also at the level of the gut, we're sort of at a point, what I call, I tell folks, we're at this functional medicine 3.0 when it comes to gut, and moving on very close to 4.0, where besides just thinking about microbiome, we're thinking about postbiotics, prebiotics, a little bit more sophisticated thinking around the gut, and we're using even specialized things for the gut. So those are like the advancements in functional medicine, where we're moving the dial with patients and their data and their immune systems, but mostly helping them feel better. And they feel better because they know their why, and they feel better because they're on a better directed treatment plan.
And they're actually involved in their own care,
Yeah.
which is what we want. We need to empower women.
Yeah.
So yes, it's we have to, you have to feel good physically, right? So even if you're going to start doing some of the deeper mental, emotional management, I mean, it all goes hand in hand. But yes, you want to start, if you're having gut issues and if you're having histamine reactions, which is what I'm seeing kind of and I interviewed somebody on histamine. I don't think I really understood it. It's an immune response. And I don't think I understood that as, I guess we always think of that as allergies. And allergies are just kind of like, whoa, it's like really intense, right? But there's also lower grade, or a little bit, like you tap somebody in the shoulder to get their attention, and then you start tapping harder, and then you can scream. So it's just your body trying to say, there's something not right here. So that is, yes, doing all that physical stuff and reducing symptoms and getting people to poop every day, which is a big thing that's not really happening, getting the function of the gut. Question for you. What I notice a lot, and you've mentioned blood sugar, and I can't remember what other metabolic breakdown conditions you were mentioning, but what I notice so often is cholesterol. And women have elevated cholesterol, which I even think that we haven't been looking at that correctly in Western medicine. Women are at 200, a little bit over, and they're on statins. And so I think we're even not really addressing cholesterol the right way, because it is a precursor. It's what makes hormones, and hormones are bone health protective. And then also thyroid. So I see thyroid and cholesterol as breakdown systems in the bodies of women with osteoporosis. Do you notice that?
I notice it with a lot of systems issues because in my training, now that I think about cholesterol, I don't see cholesterol as solely a heart attack risk. I see cholesterol as a response, your liver's response to inflammation. So cholesterol really is an inflammatory response. And when I'm looking at cholesterol, you mentioned 200s, the total calculated cholesterol. When you look at cholesterol in the primary care setting, it's a calculated number. It's not a defined number. It's just whatever is an estimation that's looking on a blood test. So if you have a woman who has high cholesterol and her LDL is 150, the PCP might say, you need to be on a statin. I don't know if she needs to be on a statin or not. And sometimes some people do need to be on a statin, but I look at more data and I look at people's risk factors and I make this case of like informed decisions about, does that make sense or not? And when I look at patients who come to me with high cholesterol, who maybe have that background, there's osteoporosis and maybe some other metabolic risks in there. The first thing I do is I do a fractionated cholesterol, a different test. That really defines the cholesterol. It'll look at LDL and it'll actually, first of all, give you an actual number, not a calculated number. And that's called your LDL particle number. And so I look at that and I'm like, well, yeah, it's high. And so it just tells me you're inflamed. So then I look at the next levels of that fractionated number and I'll look at the small LDL. The small LDL is what matters. And if you have a lot of small LDL, then that tells me that your inflammation is bad enough that it's now oxidizing your LDL. It's what I call just, bad inflammation. And if you have a lot of small LDL, that's what puts you at risk for a cardiovascular event. So a lot of times my young folks may have high LDL, but if I go look at that small LDL, it's normal. And the high LDLs or the LDL particle number is high just because they're inflamed. And I'm like, you don't need to be on a statin. That's not your risk. It's just that your body and your liver are responding to inflammation. And that's the response, is to bump up cholesterol. And so then, we go at the base of that, like, why is your liver inflamed? And we go at inflammation and balance that out and sort of try and find that why. I do have folks who also have a lot of small LDL. I don't put them on a statin, but I tell them, look, this is important to clean up. And so then we look at how do we do with oxidized LDL and really more difficult inflammation, sort of that oxidized inflammation. So I see that stacking with other things, like oftentimes they might be pre-diabetic too, because that's another oxidized inflammatory event, because that's what turns on insulin resistance. So that's sort of how I look at cholesterol, first of all, and totally in a whole different lens, is it's mostly inflammation. I love metabolism. I actually started off in functional medicine, totally interested in metabolic health. And then I became very humbled when I realized the metabolism became dysfunctional when there was an inflammatory event, because it's an inflammatory trigger that's going to get you insulin resistant. And so once I started paying attention to that, then all of a sudden people's stories made more sense as to why a young person was pre-diabetic and didn't eat donuts and didn't have high glucose, and totally can be pre-diabetic when they're hypoglycemic. That whole concept you talked about, this sugar balance. So that's when you're stepping back and you're getting more complex or more clarifying information at the root cause at a cellular level, and looking at those mechanisms of how they might be connected. So that's sort of how I see cholesterol. And so I'm looking at it from that perspective, which is nice or very important, because it then opens up opportunities of treatment. So if somebody is that person who does have osteoporosis, does have tons of bad inflammation, like it's oxidized LDL, they might be pre-diabetic as well, then it just opens up the toolkit of what the heck we can do for that. Now you can do all these things for inflammation at the level of the gut. You can go looking at sauna treatment because there's some data on sauna and oxidized LDL. You can, it just really opens up that toolkit of all the things that you can offer and empower people to get to what really is the cause of their high cholesterol.
So what I take from all of this is that traditional medicine, that approach is so start of that domino line and really not even addressing the domino line. And it's a shame. And people have insurance or they have Medicare. So it is the way we go. And, not everybody can afford to spend lots and lots and lots of extra money on going deeper. However, this is a deeper issue. It's defend and build. It is a deeper issue. And so I think coming to you, for those that can come to you, you're in Denver. And can somebody come and establish a relationship in one visit and then do everything else virtually from there?
Yes.
Okay. So that's what I think is a really great for those that can. And yes, I'm sure that there are some insurance-based testing you can run, but when you start to go deeper, a lot of these tests are not covered by insurance. So it's an investment for time and money. And really, what's more important than health? So there's that level. So let's, though, just give a couple of tips because I, have my programs that deal with gut also. Let's just give a couple of tips to women we both believe that you have to really focus on the gut primarily. So a couple of tips. I mean, you mentioned the sauna, which I think is great because that's, there's a lot of pop-up places now that you could go get your sauna treatments. Infrared sauna, are we talking infrared sauna?
Just cryotherapy. Quite honestly, when you look at the data, you just have to sweat and get hot. You can optimize that and go to the Swedish, steam saunas where the data is where the data is. But far infrared, because it's accessible, it's easy to get to. I tell my patients, wherever you sit, get hot and sweat. That's good.
I went into a sweat lodge. Have you ever done a sweat lodge?
Oh, I haven't, but yeah.
I was so scared. I did that. I went to Sedona on a spiritual retreat. I was like, oh my gosh, but I was really challenging myself. I have an infrared sauna. That was a purchase that I made. I thought that was great. Okay, so maybe some recommendations from the dietary aspect, because I want to give women something when they listen to this.
Yeah.
I want them to understand how much, like how many layers this is. And let's just give them some things after listening to this that they could do. So for focusing on the gut, are there some dietary recommendations you make that are pretty generalized?
Yeah, and I think a very important place to start when we're trying to stop defending ourselves, we're just trying to shut down histamine. I tell folks, probably the most, if Mother Nature didn't make it, don't put it in you, first of all. So there's so many processed foods and there's a lot of cut the corners kinds of foods, and the food industry is bringing stuff in that sort of looks like food. And I think the whole idea is they're thinking that it's supposed to help, save hungry people because we're going to be able to make all this food to save people. If it didn't come from Mother Nature, from an energetic space, it's not contributing to your health. And it's actually probably your body's responding to that in a defensive state. It's saying, what the heck is this? So I first and foremost, I tell folks, if Mother Nature didn't make it, if you're looking at the ingredients and you can't figure out half of those ingredients, it shouldn't go in you because it's not energy for you and it's going to be more of a defense signal. It's going to put your body at defense. So that's rule one I tell my patients. And then the next layer after that, I tell them the next sort of challenge in our dietary world is gluten and dairy. Just for the sake of just being very complex, nuanced, new inflammatory triggers. It's not an old, it's our version of those foods is so inflammatory, and it's inflammatory to everyone. But if your gut is at challenge, your gut will read it as a defense if you don't have a healthy gut. So if you're already in a challenging place, at least those two things in our diet are a problem. And if it's just processed sweeteners and such, which is very common in our diets, emulsifiers, preservatives, those two will put your body in a defensive state. So those are easy subtractions, that one can make to stop the histamine triggers. And then the additions, because I don't like to always think of subtractions, at least with diet, because people already come to me taking so much out, and they're like, I need something to put back in. And the put back ins in terms of a diet is you need a lot of good protein and fiber to keep your gut healthy. And those fibers are not just, I think, the fibers that help build up your microbiome, those resistant starches, those fibers that when you put in liquid, they thicken up, like, chia seeds and flax seeds. Those are sort of go-tos that I tell folks to put into your diet.
Yeah, that's great. Do you have a recommendation for grams of protein, grams of fiber to shoot for?
Yeah, we need more protein. It's always a balance, though. But I do tell my women, especially when your patient population who's thinking about osteoporosis, typically, or the menopausal woman. The menopausal woman needs at least minimum 30 to 40 grams of protein per meal, or 100 grams per day minimum. But I tell my gals and men, I'm like, you can't push that protein without fiber, because I know that will switch your microbiome. If you're protein dominant, you don't get enough fiber to balance out your microbiome. So I am all for 100 grams of protein per day, but it's got to be balanced with the fiber. And from a fiber source, really, I tell my patients, if you can get extra, I tell folks you should get at least 2 to 3 tablespoons of a good fiber in a shake in the morning. And then you have to have your vegetables. And when you look at your servings of vegetables, the more the better. I tell folks, when you look at that gram, if you think about it, it should be at least 30 to 40 grams per day, minimum. And actually, our ancestors had much more than that. And it's the problem of our modern diet is not enough fiber. But I like to define that by separating it from, a fiber you throw in your shake and the fiber you're eating in your diet, or at least with the greens and the vegetables and the cruciferous kinds of foods. I like both of those for different reasons.
Yeah, so amazing too for doctors to be talking about food. Question, in medical school,
Mhm.
how long was your training as a doctor to speak to your patients about food?
Hmm. I don't even remember. I think it was mostly medical school, not necessarily residency or clinical work. And when it was training, here's the thing. When it was truly training, I think the data shows it's less than 2 hours. And if that's absolutely probably true. But even if I did look for it, because I think I was one that was interested in nutrition stuff. So when I looked outside and on my own looked to gather that data, and even now, if I were to go to the conventional nutritional data, it's so outdated. When I was in conventional medicine, I would advise my patients to get the heck off carbohydrates because they were pre-diabetic. And I had a nutritionist in the conventional world turn me in because I was guiding people how to get to ketosis. And it was so dangerous if you were like under 100 grams of carbohydrates. And I'm like, are you kidding me? This is why people are diabetic, because the conventional nutritional guidelines will keep that total carbohydrate really high. And so even if you were looking to get guided as a medical doctor, it would be conventional training, which is still, very antiquated. And I think the greatest thing about carbohydrates, insulin resistance, is that these days you could just put on a continuous glucose monitor, and holy cow, will that give you so much information about what your carbohydrates doing. And so that conventional guidance, I would imagine those monitors will be above 200 on a regular basis if we were really, really quantifying what that conventional nutritional guidance is doing, really. When we're really trying to get people insulin sensitive, that food knowledge is important, but we have to look for that functional nutritional knowledge.
Yeah, so what I took from that is
Mhm.
that when we talk about that word conventional, traditional, which is what we're doing here,
Mhm.
It's antiquated, it's outdated, but the bigger thing is it's controlled.
Yeah.
And it is controlled by big pharma, big food now, we're talking big food now, and health insurance. And so we have been controlled, and that is what I wanna just raise awareness to.
Yeah. Yeah.
So yes, well, I just wanna say that anything else you wanna share before we end?
I think we're in a space, you and I realize this. We're in this awareness and awakening. And it's really cool that I think people are awakening. And when you're in that awakening, you start seeing like, wait a minute. You put the brakes and you start questioning. And that's where we are in history. And I think just like in history, big power, big pharma, big, corporate medicine is in shaky ground right now. And I think that, I think the narrative out there, I think the person who's interested in this has to be attuned to this growth and this awareness, but realize that in this growth and awareness, this story and this narrative is going to be controlled too, and what is in social media. So it's always important once you sort of find that knowledge is to stay in that space, because there are going to be other narratives that are come and say, no, this is, I noticed that historically, especially in the last couple of years, that that for every aha moment in functional medicine that we're trying to bring to people to learn, there's going to be a narrative that says that's wrong. And so there's going to be this back and forth knowledge that it's really going to be important to find your guides, find your sages of knowledge and that space, so that you can be comfortable and confident that these little spaces of resistance and growth, that you're still in line with what makes sense to you as a patient, because there'll be a narrative that's going to be pushing up against this, if it already isn't. It is there, but I think it'll get more. It'll become more difficult, to sort of stay in this space.
Yeah. Difficult to stay in the space of wanting to learn more and being able to find the answers versus all of the other stuff out there trying to push back. Yeah, I agree. And that's one thing for me, like I am going to really help to be a part of this good information. And I'm also like, uh-oh, what am I going to be up against? But honestly, I'm like, put up your dukes, pukes.
Yeah. Because that's history. It's history. I think what comes through historically is truth in the end. The truth really does come through. And I think it comes through, it becomes a grassroots, it becomes the people who are doing that. And I think that awareness is there. So I just, those of us that are in the space here for the people, we're here. And I think that momentum is just going to continue to pick up, which is exciting. It's going to be more of a, as you mentioned, put up your dukes sometimes. But that's sort of how change has to happen. And I think this is we're setting up in this prime space for that right now in the health world.
Yeah, and I'm so grateful to be in this space with you.
Yeah, no, it's you and I and the rest of us. I think also sort of need to be brave enough and courageous enough to stay. I say that just because I always tell myself that, because it is, for a provider like myself, saying these things, I run the risk of somebody coming at me and saying, I'm going to take away your license because this isn't evidence-based medicine. And so it is. For us to be in this space, you have to always defend your knowledge and show your science, which I have no problem doing. But we always have to come with that, because it's not my patients who are, who would basically come to me. It would be my colleagues who are saying, that's, wacko medicine that you're bringing, and you're pushing up against us too much, and you're feeding people power. Actually, really, you're getting people empowered, is what we're really doing, but they may not see it as that. So it is a challenging time. And I think people don't realize medical doctors who are sitting in this space have to be, pretty sound with our knowledge and and really hold ground with science. So it's not like we're just talking out of nowhere. We're sort of having to keep that clean. And so I could say those things because, yeah, the science is still clean about that.
Yeah, I love that approach. Okay,
Yeah.
I'd love to end with this.
Yeah.
You said that the truth always prevails.
Yeah.
So I would like to ask you
Mm-hmm.
the truth about bone loss. Is bone loss reversible?
Mm-hmm.
I'd like
Yes.
to know that. It is?
Yes.
Okay, good.
I would say the answer, because patients ask me that, is this reversible? Because after we look at their data, they get overwhelmed and they're like, well, can I reverse this? I'm like, because you have the answers, because you know your why, now you can go and reverse that. And yes, your body always wants to be in homeostasis. The times that it's not reversible, I tell people, is when your inflammation is such a mess and you're older. That's when it becomes difficult, but it's not that it's not reversible at that point. It'll be more difficult to reverse that. But more important, if you're 85-year-old and you're like, how am I going to build a muscle when I'm now, 85? You can still maintain. The amazing thing is you may not be able to go build the muscle, but you can maintain it. And then you can build everything else around that. If you can't build that bone back, because I think part of it is just adjusting where you are with your immune system and your metabolism, not only for your bones, but for everything else. And yes, you can pull your metabolism to a better place, pull your immune system to a better place. And if it's not 100% fixed, it doesn't matter. Your body's going to, calibrate itself to a much better place. And what I'm just trying to do for my 80-year-old is don't break the hip.
Yeah. Okay. Thank you so much for sharing.
Yeah, thanks.
I know I'm going to get a lot of great feedback from this interview.
I would love, let me know if you need any other clarification or, if things come up that need, if there's, common questions that you need me to answer for you. Happy
Okay,
to chat.
great. Thank you.
All right. Well, thank you for having me.
Thanks for joining me on Stronger Bones Lifestyle. Are you ready to take charge of your future? For show notes, resources, and information on my programs, please visit DebbieRobinson.com. If today's episode empowered you, be sure to subscribe, leave a review, and share it with someone who needs it. Together, we're building stronger bones and stronger lives. Take care, and I'll see you in the next episode.